prostate enlargement awareness to the general public. Dr. Ignatius Asasira, a medical officer from Mulago Hospital, has shared health tips, especially on prostate enlargement, which causes prostate cancer in men.
The men, especially those above 40 years, significantly, there is a lot of prostate enlargement, benign prostatic enlargement issues. We can't tell whether it's a BPH, what you call benign prostatic hyperplasia, or it's a cancer prostate, but at least you see the symptoms are very clear. And maybe as we send the information out there, any man above the age of 45 and you have, difficulty in initiating your urine stream, the stream has also reduced, you're waking up so many times in the night, you're having terminal dribbling, even when you're done urinating, there are still some drops which are falling in your pants, or even you're done urinating but you feel the bladder is still having urine, yet there is nothing coming out. These and other conditions like reduced urge of sex or even the sexual drive are what you call the lower urinary tract symptoms, and they point out an enlargement of the prostate. So every man out there who is watching this, when you're above 45 or you have a father who is above 45, please tell them it is important to do annual prostate screening. Do annual prostate screening, understand what is happening. There is a test called the PSA, prostate surface or specific antigen. We encourage everyone out there, please go and test, because cancer prostate is killing our patients at a very high rise in this country.
Dr. Asasira says that prostate enlargement is caused by a number of things, as he explains.
The biggest percentage is a physiological change. It's a normal occurrence. As you grow old, the prostate also enlarges. But then there are other things that put you at a higher risk. For example, if you have someone in your family who has had prostate enlargement, you stand at a higher chance. If you have had a pelvic surgery or a radiation exposure within any of your pelvic parts, you also stand at a higher chance. Or lifestyle. People are having a poor lifestyle. They are not exercising. They are, living a sedentary lifestyle. They are obese, eating a lot of junk, and it gets coupled with alcohol intake and using drugs. In this drugs and alcohol are being misused a lot, and these are not specific for prostate, but all cancers, all malignancies, and most other non-communicable diseases. What you need to know is that cancer is a very lengthy process. By the time you get cancer, it means your body has been struggling for the last 10 to 15 years. So it's best you screen early so that we can get it when it's still in the pre-cancerous phases, instead of waiting to get it when it's advanced.
For those who think that a high sex libido leads to prostate enlargement, Asasira has answered you.
No, having a high sex drive and high libido does not increase the chances. Actually, previous literature, which was later nullified, used to believe that people who have a lot of sexual exposures at a lower chance. Although later, science came in and research came in, but we didn't really appreciate that theory. But nevertheless, we encourage people not to believe the myths. There are people who say when you masturbate, you're at a higher chance. When you have a high libido, you're a higher chance. Those who never engage in a sexual activity are at a higher chance. It's really very, very dispersed data from what we are seeing from the patients at Uganda Cancer Institute who are having cancer of the prostate.
Prostate enlargement has got a number of signs and symptoms.
Yes, one of the common complications or symptoms that will present later is reduced sexual urge. The sex drive goes on reducing. So if a man has been performing maybe 10 minutes or 5 minutes, it's now 1 minute and is already, And I've met one who has even diabetes, and on top of the prostate enlargement, he also has a diabetic erectile dysfunction. So it's just a concoction of so many non-communicable diseases. So yes, it may affect your sex life and subsequently your family life, but that's not the end of life. It's important to discuss this with your wife as well. They need to understand, so they come in to support you instead of when you're looking at it from the aspect of sex, but rather from a holistic approach of this is a human being who has fallen sick and needs care, just like a lady can also get sick and needs care.
Story by M. Frank and Kisto Henry, UCTV News.